Hi, welcome to another episode of Medicine Simplified. Today we will know about Frey syndrome, its causes, signs and symptoms, diagnosis of Frey syndrome and treatment. So what is Frey syndrome? It is also known as Auriculotemporal Syndrome or Gustatory hyperhidrosis syndrome. Frey syndrome is post-operative phenomena following the salivary gland surgery, especially parotid gland, and less commonly neck dissection, facelift procedures, and trauma. It described as sweating and flushing in preauricular region in response to mastication or salivary stimulus. Patients with Frey syndrome often present with facial warmth, flushing, and sweating in territory of auriculotemporal nerve overlying the parotid gland, which may include preauricular skin, temporal skin, scalp, and TMJ region. Symptoms occur during meals, especially with spicy and sour foods, which increases the salivary secretions. Coming to the causes of Frey syndrome. The auriculotemporal nerve consists of two roots. The superior somatosensory root, which arises from mandibular branch of fifth cranial nerve, trigeminal nerve, providing the innervation to auricle, external auditory canal, TMJ, lateral tympanic membrane, and temporal scalp. The inferior parasympathetic root arises from postganglionic fibers at otic ganglion, which originates from glossopharyngeal nerve. It is responsible for visceral secretomotor action of parotid gland. After the two roots join, the auriculotemporal nerve travels posterior to the mandible and parotid, where it gives off secretomotor parotid branch before coursing across the superior border of mandibular condyle below the TMJ and terminating in temporal region. This is the anatomy of auriculotemporal nerve. So the main cause is Frey syndrome occurs if auriculotemporal nerve is proximal to the parotid branch or parotid branch itself is injured. So injury to auriculotemporal nerve causes Frey syndrome, and aberrant re-innervation of postganglionic parasympathetic neurons to nearby de-innervated sweat glands and cutaneous blood vessels. So injured nerve fibers will try to regenerate with sympathetic nerves. Signs and symptoms. Symptoms include sweating and flushing on cheek, temple or near the ear, particularly when eating food with more intense flavors such as sour, spicy or salty foods, which causes excess salivary secretions. There is sometimes pain in same area, often burning in nature. Between attacks of pain, there may be a numbness or other altered sensation, paresthesia or anesthesia. This is sometimes known as gustatory neuralgia. Coming to the diagnosis of Frey syndrome. Diagnosis of Frey syndrome is based on clinical history, but confirmatory test can be done with minor starch iodine test, also known as minor test. The affected area of face is painted with iodine, which is allowed to dry. Then dry cornstarch is applied to the face. The starch turns blue on exposure to iodine in the presence of sweat. As you can see in this picture, the first one is application of iodine, then application of starch. When salivary stimulus is given, the sweating starts and it turns into blue. This test is known as minor test. Coming to the treatment of Frey syndrome, it includes both surgical and pharmacological management. Thick skin flap. Increasing the thickness of skin flap raised over parotid gland during the surgery by including fat and superficial musculo-aponeurotic tissue can theoretically protect the sweat glands and nerve fibers from being exposed. This pressure is during parotidiectomy. Acellular dermal matrix (ADM) is extracellular connective tissue graft generated via decellularization process wherein the cellular component of dermis are removed. ADMs can function as biological barriers between the parotid bed and overlying skin. The important one is botulinum toxin is the most widely used agent for local injection with dosing between 1.9 and 2.5 units per centimeter square in involved area. Botulinum toxin acts as anticholinergic and blocks acetylcholine release at neuromuscular junction, which produces chemical degeneration and paralysis of both striated muscles and sweat glands. If you like this video, please do subscribe to our channel. Thank you.